Good morning. We're here to give an update on COVID-19 in Oregon, and I'm joined by Patrick Allen, Director of the Oregon Health Authority, Dr. Dean Seidlinger, our state epidemiologist, Dr. Renee Edwards, Chief Medical Officer for Oregon Health Sciences University, and Dr. Bill Messer, Assistant Professor of Infectious Diseases at OHSU School of Medicine. I invited these public health and medical experts here today to give an update on where we stand in our fight against COVID-19 and what lies ahead with the recent discovery of a newly identified mutation of the virus right here in Oregon. But first, I wanted to take a moment to address President Biden's audacious announcement last night that all Americans will be eligible for a vaccine starting on May 1st. We are all hopeful we can safely be reunited with our family and friends for small gatherings by the 4th of July. And as your governor, I will do everything I can to make it happen. Our plan in Oregon has always been to align our vaccination timelines with available federal supplies. As weekly shipment allocations increase, we will reassess those timelines. If the doses are there, I have every intention of utilizing all available state and federal resources to match the president's timeline for universal eligibility. Director Allen will address Oregon's capacity for vaccine distribution in more detail. But let me be very, very clear. While our timelines will accelerate with available supplies, my commitment to equity in our vaccine distribution will not change. We will continue to prioritize our most vulnerable Oregonians, including seniors, people with underlying health conditions, and our frontline workers, so that they can be at the front of the line. It's truly remarkable to think about what is possible today when we remember where we were on this day 1 year ago. Today marks 1 year since I extended the spring break period for Oregon schools just days before we shut them down completely. I remember the great uncertainty we faced with this virus at that time. 1 year later, we've certainly learned a lot. We know how to safely create low-risk environments in schools and the necessary public health measures to reduce transmission. And just this morning, I signed the executive order to reopen Oregon schools for in-person instruction. I'm happy to report, as of this week, there are now more than 174,000 students back in the classroom. And we're excited that all of our kids will have the opportunity to return in the coming weeks. I'm also thrilled that following the return to in-person instruction this spring, we'll be able to bring back the summer enrichment programs that spark joy and foster creativity for our children. And we'll do so more equitably than in years past, ensuring that families from historically underserved communities have access to summer programs and making sure the programs offered are culturally relevant. The $250 million package I announced with Speaker Kotek and President Courtney earlier this week significantly expands summer learning and childcare opportunities for our families that have been hit hard by the impacts of COVID-19. After the hardship Oregon's kids have endured throughout the pandemic, it's a step forward to offer this time and space to encourage healing, additional learning, and have a little fun this summer. This investment will be complemented by the resources from the $1.9 trillion American Rescue Plan that Congress passed and the President signed yesterday. I'm incredibly grateful to the Oregon congressional delegation for all of their work to get this package over the finish line. It will provide much needed relief to Oregon families, help small businesses get back on their feet, allow renters and homeowners to stay in their homes, and accelerate our timelines to crush this virus. We're also making progress on the vaccine front. We're now 47% through Oregonians who are over 65, and over half of seniors over the age of 75, in addition to being largely complete with our educator workforce. With 3 safe and effective vaccines now available and more supplies coming in from the federal government, we are getting an average of 24,000 shots in the arms of Oregonians each day. That's truly amazing, and I'm so encouraged to see so many Oregonians who are eager to get the vaccine when it's available to them. Along the way, Oregon continues to shine in how our communities are coming together to beat this pandemic. For example, in Malheur County, the Klamath Health Network and Valley Family Healthcare have transformed a used ambulance into a mobile unit to reach remote Oregonians for both testing and vaccinations. Mosaic Medical, serving Central Oregon, is using the remaining vaccine doses allocated to their staff to go on-site and immunize Oregonians at the region's largest shelter for unhoused people. One Community Health has been literally going door to door to share information, arrange transportation to vaccine sites, and coordinate social services for tribal communities along the Columbia River. This is incredibly creative work, and I'm so proud of the work our communities are doing and going the extra mile to help one another out. We must also continue to make smart choices around the public health measures we know work. Because while we know vaccine supplies are ramping up, enabling us to reach more of you more quickly, we are most definitely not out of the woods just yet. I wanted to close by talking about a significant challenge on the horizon: the discovery of a new COVID-19 mutation believed to have occurred spontaneously here in Oregon. This is the latest sign that this virus is capable of evolving. It's certainly alarming and an important reminder that even in this semi-vaccinated chapter of the pandemic we find ourselves in, where grandparents may be safer, kids are going back to school, and we're all feeling a bit more hopeful, we must still keep our guard up. Let's use this moment to keep making smart choices and venture slowly out onto the ice. We have come so far, with counties across the state entering lower risk levels and reopening businesses and schools. We don't want this to be a moment where the ice cracks below us. So keep wearing your mask, continue to physically distance, no large gatherings just yet, and get the vaccine, any one of the 3, when it's made available to you. We just need to hold on a little bit longer. And with that, I will turn it over to Director Allen to give a vaccine update, and then over to the doctors to share more on the mutation and what it means for all of us. Over to you, Director Allen.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority, and today I'm joined by Dr. Dean Seidlinger, our State Health Officer. This morning, I'll update you on vaccinations in Oregon and tell you about a new group of people who will now be eligible to get vaccinated on March 29th. Dr. Seidlinger will share the findings from our latest COVID-19 model and what the forecast looks like in coming weeks as we continue to ramp up vaccinations and monitor the spread of new COVID-19 variants. But first, I want to echo Governor Brown's comments about President Biden's speech last night and his direction to states to open vaccine eligibility to all adults by May 1st. We appreciate the administration's commitment to delivering enough vaccine to meet the president's goal. Oregon is ready. Oregon's vaccinators have the capacity to double our current average number of doses administered per day, which is about 24,000 today. Oregon is on track with our current eligibility timelines, which we set based on our current allocations. We've been clear we want to advance our timelines, and we can move them up if we receive enough doses from the federal government. However, We need to know when more vaccine vials will actually arrive in Oregon as promised before we can tell a frontline worker or anyone else that we're adjusting our timelines. We know the previous administration made major announcements that they weren't able to fulfill. While this administration has met its commitments so far, we don't have any specific information about when any additional doses will arrive. Until we get more clarity, we need to keep our current timelines in place. We can't disappoint people who eagerly want a vaccine. We need to see the increased doses in the federal ordering system. Right now, no one in the federal government has given us hard numbers on what we can expect and when. We don't yet have more doses we can order. So let's look at where we stand right now. Let's go to the slides, please. Based on today's numbers, Oregon vaccinators have administered 1,269,595 first and second doses. Over the past 7 days ending yesterday, Oregon vaccinators reported administering an average of 24,151 doses per day. More than 800,000 Oregonians have received at least their first dose. Oregon has administered first doses to 19% of our population, or almost 1 in every 5 Oregonians. The national average is 19%. Oregon has complete 1 or 2 dose vaccination series for 454,321 people. Overall, 11% of Oregonians have been fully vaccinated. We remain ahead of the national average for fully vaccinated people. The national average is 9.9%. Based on these numbers, Oregon remains on track with our vaccination timelines. Let's start with older adults and go to the next slide, please. As of Wednesday, Oregon had vaccinated 356,830 adults over 65. That's 47% of seniors. As this slide shows, we've vaccinated 6 in 10 Oregonians who are 80 or older, and more than half of people 75 and older. By the end of March, we expect we will have vaccinated 8 in 10 seniors before we open eligibility to the next groups, including people with underlying conditions. We do see variations in senior vaccination rates across counties. At present, more than 80% of 75-year-olds and above have been vaccinated in Deschutes County, for example. However, other counties are lagging. This week, we're providing one-time catch-up doses for 7 counties. The extra dose amounts will go to Clatsop County, 700 doses, Columbia County, 1,100 doses, Coos County, 1,400 doses, Curry and Grant counties, 500 doses each, Jackson County, 2,040 doses, and Josephine County, 3,080 doses. In addition, as the governor mentioned, Oregon is essentially finished vaccinating educators. According to survey data gathered by the Oregon Department of Education, 87% of school districts reported that 100% of their staff had been given an opportunity to get immunized against COVID-19. And another 5% said that 90% of their staff had been offered a vaccination. Will there be a teacher or childcare worker who hasn't been given an opportunity to get vaccinated? Yes, but those cases should be the exception. Now let's look at our allocations going forward. Let's go to slide 3, please. Currently, Oregon is receiving 126,530 first doses per week from the federal government. That allocation includes 56,160 doses of the Pfizer vaccine and 40,800 doses of the Moderna vaccine. There is no news on when consistent allocations of the Johnson & Johnson vaccine will begin, though we did receive notice we are receiving 4,800 doses for shipment next week. The federal government is also shipping 31,470 doses directly to retail pharmacies and 4,000 doses to federally qualified health centers. Based on what we projected prior to the president's speech last night, by the end of March, we expect our weekly supply of first doses to increase to more than 200,000 doses per week. Our currently projected allocations put Oregon on track to administer first doses to more than 1 million people by March 29th, or about 77% of all currently eligible people, from healthcare workers to first responders, to nursing home residents, teachers, childcare workers, and all eligible seniors. As a result, on March 29th, we will open vaccinations to people 45 and older who have underlying health conditions, along with migrant and seasonal farm workers, wildland firefighters, seafood and agricultural workers, and other groups. I also want to announce one eligibility change. All pregnant women 16 and older will become vaccine eligible starting March 29th. Since most women who are pregnant are younger than 45, we wanted to make sure every pregnant woman who had the opportunity to get vaccinated when we open eligibility to people with underlying conditions. This week, we'll also expand our pilot program that enables federally qualified health centers to vaccinate all of their patients 16 or older. Let's go to slide 4, please. Starting the week of March 15th, we'll increase our dose allocations to FQHCs by 4,500 doses and add 4 new centers: Mosaic Medical and Mosaic Medical's Madras Clinic, Northwest Human Services in Polk County, Klamath Health Partnership, and CHC of Benton and Lynn counties to the program. The FQHC pilot is one way we're addressing the disparate impact of the pandemic and current disparities in vaccination rates. For example, Yakima Valley Farm Workers clinic sites in Marion and Umatilla counties serve a population that is over 95% Latino and Latina in communities that have seen some of the highest coronavirus transmission rates in the state. FQHC allocations help us target vaccinations for Oregonians that have been hardest hit by COVID-19. As this slide shows, on February 19th, the Oregon FQHC average test positivity rate was 12%. The highest FQHC test positivity rate was 19% statewide in December. Currently, Oregon distributes 3,700 doses per week to 7 FQHCs, operating at 20 different sites. This allocation is in addition to the 4,000 doses per week that specific FQHCs receive through the federal program. By the end of this week, FQHCs will have received a total of 21,000 doses through the state and federal allocation programs. This pilot FQHC expanded eligibility program is vitally important because FQHCs serve as a trusted source of care in the community, especially for migrant and seasonal farm workers, other agricultural workers, and food processing workers. While the pilot sites can offer vaccines without restrictions, we have asked our FQHC partners to focus on older adults during March. FQHCs also offer flexible and innovative ways to distribute vaccines to people who may have mobility limitations, transportation barriers, or who are otherwise unable to get to a mass vaccination clinic to get a shot. At least 9 centers report willingness to provide large throughput vaccination efforts offsite. 7 centers can provide mobile clinic services, and 2 centers have plans for home visits. And you heard several stories that the governor shared about specific activities at different FQHCs around the state. Now, here's a brief update on our collaboration with the All for Oregon partnership that's operating the mass vaccination clinic at the Oregon Convention Center. Starting with a pilot last week, we've implemented a new system to make it faster and easier for seniors in the Portland metro area to schedule an appointment at the Oregon Convention Center. OHA pulls a list from people in the Portland metro area who've registered using the Get Vaccinated Oregon tool. We then send an email or text to those individuals to alert them that they will be receiving an email from All for Oregon with an invitation to book their appointment at the convention center. As a result, seniors don't have to compete to get an appointment by logging onto a website at a certain day or time. Instead, seniors will receive an email with a personalized link that lets them schedule a date and time convenient for them. Early indications tell us the new system is working well. This week, All for Oregon scheduled appointments for more than 16,000 seniors to be scheduled this week at the Oregon Convention Center. To date, All for Oregon has delivered more than 160,000 vaccinations at the OCC since opening on January 25th. This new system is easily scalable. As vaccine supply increases, as we expect we'll see in the weeks ahead, it can easily accommodate larger numbers of people who've registered. If you want a vaccine appointment or information about vaccination efforts in your area, go to the Get Vaccinated Oregon tool and register. Seniors in the Portland metro area, if you signed up on GVO, please check your email inbox daily for the email invitation from All for Oregon. And be sure to look in all your mailboxes, not just your primary inbox. If you no longer need a vaccine or vaccine information, please delete your GVO account. Finally, I want to end on one important point, which is related to the information Dr. Seidlinger and Dr. Edwards will provide on variants. I want to underscore that Johnson & Johnson was 100% effective in preventing COVID-19 deaths during clinical trials, which were conducted in parts of the world where new variants were already circulating. This past week, Oregon received 34,000 doses of the Johnson & Johnson vaccine and will receive 4,800 more next week. To date, vaccinators have administered 5,687 doses of Johnson & Johnson. We know some counties are using the more flexible 1-dose vaccine to vaccinate harder to reach seniors and other groups of people, which affects their speed in rolling out this vaccine. We also know people have asked questions about how the one-dose Johnson & Johnson vaccine compares to the other two-dose vaccines. It's important for Oregonians to understand that all our vaccines are the safest and most effective way to stop the spread of the virus. The best COVID-19 vaccine is the one you can get. Different vaccines were measured through clinical trials conducted at different times in different places, measuring different outcomes. All our vaccines are proved to be safe and reduce your risks from COVID-19. Oregon is deploying the Johnson & Johnson vaccine in all settings to provide people and communities in all parts of the state. We're allocating Johnson & Johnson to mass vaccination clinics in the Portland metro region, to local public health agencies, to pharmacies, and to other vaccination sites and providers all across Oregon. We see Johnson & Johnson as one of our most effective and flexible vaccines. I appreciate Governor Brown getting immunized with the one-shot vaccine last weekend. When it's my turn to get a vaccine, I'll be happy to get whatever vaccine is available. Now, let me turn it over to Dr. Seidlinger to talk about our latest COVID-19 forecast and what OHA is doing to monitor the emergence of variants. Dr. Seidlinger?
Thank you, Director Allen. Before I discuss the most recent COVID-19 forecast, I'd like to briefly summarize the status of the pandemic in Oregon. We continue to see a general trend of declining daily COVID-19 cases, hospitalizations, and the percent of positive tests as vaccines become more available to Oregonians and as risk levels subside for counties across the state. This is a result of the continued work all Oregonians are taking to protect themselves and their families. So thank you. Just 10 weeks ago, as 2021 dawned, our 7-day rolling average of daily new cases was 1,149. As of yesterday, the 7-day rolling average was 295, a 74% decline. In our most recent weekly report for the week of March 1st through the 7th, OHA reported 1,729 cases, a 35% decrease from the previous week. To date, there have been 159,037 reported cases of COVID-19 in Oregon. COVID-19 hospitalizations are also trending dramatically lower. On January 2nd, OHA reported 466 virus-stricken patients in our hospital. Yesterday, there were 121, or 74% decline. And last week, we reported the lowest weekly total of COVID-19 patients in 5 months. The percentage of positive tests has also dropped to 2.8%, which is the lowest since our change to a test-based testing method in mid-November. COVID-19 associated deaths have also fallen from their peaks in December. To date, there have been 2,319 COVID-19 related deaths in Oregon. Every death represents the loss of a loved one, a neighbor, a friend, or a colleague. My thoughts go out to everyone who has experienced a loss due to COVID-19. Just a month ago, 27 of Oregon's 36 counties were classified as extreme or high risk from spread of COVID-19. Today, there are 11. Today, only 2 are considered as extreme risk, and 25 counties are at moderate or lower risk. And more good news, the CDC has issued guidelines around interactions for fully vaccinated people, allowing small gatherings in private places. All of this is really encouraging news, and it's a testament to our collective efforts to control the spread of the virus. And I say thank you, Oregonians. But as it seems with all things COVID, progress is conditional. The virus is dangerous and it remains a threat to all of us. Recently, we identified a case of the P1 variant, a more contagious variant of the COVID-19 virus originating in Brazil. This was a resident in Douglas County who traveled to that region. This past weekend, it was reported that a mutation of the B117, more prominently known as the UK variant, had been discovered in Oregon. These appear to be isolated cases, but they can spread very quickly as we've seen in other countries. To address this concern, we will rely on our public health response for case investigation and contact tracing, as well as all Oregonians continue to take the steps to protect themselves and their families, wearing masks, keeping physical distancing, limiting indoor gatherings, and getting a vaccine when it's available to you. Variants and mutations to a virus are not unusual. We are watching these warily, but we believe that any of the existing vaccines, including the Johnson & Johnson single-dose vaccine, are effective at preventing severe consequences from these diseases, like hospitalizations and death. but the presence of these variants and the effect of the lowering of risk levels in our counties presents new risks, especially with the inviting spring and summer weather soon to be arriving. As you've heard, more than 800,000 Oregonians have received at least one dose of COVID-19 vaccine, and more than 1.2 million doses have been administered so far. More people are being vaccinated every day, and every Oregonian that gets vaccinated brings us closer to ending this pandemic. But getting vaccination is not a free pass to come to our pre-pandemic behavior, and we are months away from achieving our community immunity. Our recent modeling suggests that with the presence of the new variants and the relaxing of restrictions, we can expect to see an increase in new cases. Or put more bluntly, we can expect to see wider distribution of this virus in Oregon. But we can slow that momentum by continuing to take the steps that have been proven to slow this virus. We can protect our loved ones by wearing our masks, keeping our distance, limiting our indoor gatherings, and getting vaccinated when it's our turn. So let me turn for a moment to the newest COVID-19 forecast. We estimate that transmission rate of the virus declined slightly from early February through February 24th, with an estimated reproductive number of 0.83. If that level of transmission holds, we can expect further declines in daily cases to an estimated daily average of just 170 cases a day and 6 new daily hospitalizations between March 17th and 30th. However, if the more contagious variants take hold, or if we relax our vigilance and transmission increases by 30%, we'd see a reproductive number of 1.1, and daily cases would be at 265 with 10 more daily hospitalizations. But we must remain vigilant, and experience has shown us that small setbacks can have huge consequences. Throughout Oregon, students are returning to their classrooms in greater numbers. In-person instruction is important for the well-being and mental health of our students. OHA and the Oregon Department of Education are working to refine public health and safety protocols to allow for a return to learning with lower risk. We can't lapse in our resolve to reverse the progress that we're making. I want to conclude by acknowledging the stress and anxiety this pandemic has caused all Oregonians. The emotional strain from not seeing our loved ones, the financial toll of lost businesses and lost income, the pressures from turning our lives inside out to mitigate the impact of the virus. I realize that even good news of a return to in-person instruction is a significant change in our lives that can create anxiety for students and their families. My thoughts go out to everyone who's suffering from the stress brought upon by the impacts of COVID-19. If you or someone you know is struggling with mental health symptoms, please know that help is available. The Safe and Strong website is designed to support people who are facing challenges related to COVID-19 or other life stressors. Go to safestrong.oregon.org or call 1-800-923-HELP or 4357. If you or someone you know is experiencing a mental health crisis, please know that help is available. You can call the National Suicide Prevention Lifeline 24/7 at 800-273-8255, or for Spanish, 888-628-9454. Oregonians care about others and care about their communities. And by continuing to work together, we can save lives and rid our communities of COVID-19. And with that, I'll turn things over to Dr. Renee Edwards.
Thank you, and good morning, everyone. I'm Dr. Renee Edwards, and I serve as the Chief Medical Officer for OHSU Health. Thank you for allowing me to speak with you again today. I'm encouraged by the projections that Dr. Seidlinger has just shared with us about COVID-19 in Oregon, and I'm truly proud of the efforts that we all have made to help slow the spread of this virus in our state. It's been a difficult year for all of us, but your hard work is paying off. Because of your efforts, Oregon has the 4th lowest total number of deaths per capita, and we've maintained great performance against this virus over the last 9 weeks. On behalf of my healthcare and public health colleagues, thank you. But it's actually because of this amazing success that I'm here today to ask everyone to remain vigilant in our collective work against COVID-19 and to continue to practice physical distancing, hand hygiene, and mask wearing, whether or not you've been vaccinated against COVID-19. As we heard, Oregon's vaccination rates continue to increase. This is exciting to hear, but we still have a ways to go before we have adequate vaccination rates across the entire state. We aren't out of the woods just yet. From the beginning, we've said that tackling this pandemic would be a marathon, and we're in the last stretches, but not yet across the finish line. This is especially true as new and potentially more contagious virus variants continue to emerge and spread across our communities. Earlier this month, two concerning variants, those prevalent in Brazil and California, were found from COVID-19 test samples taken in Douglas and Lane counties. And just this week, we learned that researchers at the Oregon SARS-CoV-2 Genome Sequencing Center at OHSU have detected a novel virus variant, never before detected in the United States, but now right here in our own backyard. This variant contains characteristics of both the B.1.1.7 strain, that first found in the United Kingdom, and a newer virus mutation known as E484K, or EEK, that is currently circulating in both Brazil and South Africa. I'm pleased that my colleague, Dr. Bill Messer, a co-investigator at the center, will join us a bit later to answer your questions about this new finding. So what does all of this mean? I want to acknowledge that there's still a lot to learn about how these new variants may impact Oregonians. We certainly don't have all the answers yet. More investigation is necessary to better understand how prevalent they are in Oregon, if they may increase severity of illness, or whether they may still infect a vaccinated person. However, B.1.1.7 has been shown to be a highly contagious variant, and E484K is thought to be a key mutation in other variants of concern, which is why we must remain vigilant, as we do not want these variants to take hold in Oregon. We do know that viruses like SARS-CoV-2, the virus that causes COVID-19, constantly change. It's a common part of a virus's life cycle, which is why we're hearing of so many variants. This also means that we'll continue to see new mutations and variants emerge throughout the remaining course of the pandemic. But I want to reassure you that not all virus mutations are troublesome. While some may become more persistent or contagious, others may not affect disease severity at all, or how fast they spread, so you may not even hear of them. But this is why it's important that we use sophisticated scientific processes and technologies to identify, monitor, and report any signs of new virus variants that may result in Oregon or across the globe. Understanding how the virus is evolving will aid in information to you, to our public health response, and to our vaccination efforts. Some good news to share. We are encouraged that currently available COVID-19 vaccines do appear to be effective in preventing severe illness and death in these virus variants of concern, including those currently present here in Oregon, which is all the more reason why we must push ahead in our vaccination efforts. However, we must remember that vaccines are just one part of our toolkit. Remember, we are not across the finish line yet, and we do not want to lose this race by relaxing at the end. Incredibly, 1 year ago, almost to the day, I and others asked you to do your part to flatten the curve against COVID-19 in Oregon, and you have done just that. It's imperative that we continue our collective interventions of physical distancing, mask wearing, hand washing, and limiting social gatherings, all of which remain in alignment with CDC guidelines. Through your efforts and sacrifice, these measures have all proven effective and remain effective and vital as these variants emerge in helping to limit illness and slow the spread of COVID-19 as we cross the finish line. Thank you.
Dr. Edwards, we really appreciate you joining us from OHSU. With that, Charles, I think we're ready for questions.
Thank you, Governor. We'll get started with Sarah Klein from the Associated Press. Go ahead, Sarah.
Hi, thanks for taking my question. Obviously, Oregon has been very methodical when it comes to vaccine eligibility. However, two large groups, essential workers and people with underlying conditions 16 to 45, aren't supposed to be vaccinated until May 1st, which is obviously Biden's deadline. Does the president's announcement conflict with Oregon's very specific timeline that the state has been working towards for months now?
Thanks, Sarah, for joining us this morning. I will say this, we're incredibly grateful that the Biden administration has injected a sense of urgency into this fight against COVID-19, and they are really coordinating a national response. And frankly, the president has used every tool that he has available to him to increase the supply of vaccines. I am very, very clear. As long as the Biden administration continues to deliver supplies, and as long as those supplies are available, we will accelerate the timelines. But I'm also very, very committed to our equity framework, and that is we have to get our most vulnerable Oregonians vaccinated first. Obviously, our seniors, those with underlying health conditions, and our frontline workers.
Just a quick follow-up. I just wanted to clarify. So once Oregon does start receiving large shipments of vaccine, you're saying that those two groups, essential workers, underlying health conditions, they still will be placed ahead of the general public?
We will make sure that these folks get vaccinated. Director Allen, do you want to tackle that one?
Yeah, happy to, Governor. Sarah, I think the idea that we've talked about consistently is as more vaccine shows up, we're not only ready, but eager to accelerate our timelines and move those populations up even sooner. And it's just simply dependent on when we have certainty about when we'll receive vaccine. And when we do, we'll announce any potential changes to the schedule.
All right, thanks so much.
Thank you, Sarah. We'll go next to Pat Duras with KGW. Go ahead, Pat.
Good morning. Thank you. Two questions. One, when it comes to underlying conditions, we've had some emails from viewers wondering if the state is going to use both categories that the CDC talks about. One says are at risk, the other says may be at risk. And that second one obviously involves a lot more categories. So that's question one. The other question is, what guidance are you giving assisted living or nursing homes on visits now that adult children could be vaccinated, trying to visit their parents, for example, in their private room who are also vaccinated, and some folks are being told that that's not yet allowed? Thank you.
Thanks, Pat. I'm going to turn both of these questions over to Director Allen, but I think the good news is that due to the efforts of the Biden-Harris administration, we have the hope that there will be substantially more vaccines coming over the next few weeks, the next couple of months. And the good news is that any adult Oregonian will be able to get vaccinated much more quickly than we had anticipated. So that's really good news. Director Allen.
Yeah, thank you. Pat, the answer to the first question is we're using the CDC list of people who are at risk and not the CDC list of people who may be at risk. And that list of who we're considering to have underlying conditions can be found on our website. To the second question, the Federal Centers for Medicare and Medicaid Services issued a directive that visitation be resumed in skilled nursing facilities. And that guidance is binding on Oregon Department of Human Services. They are also considering changes to their guidance with respect to other facilities, but that's a process underway right now.
Okay, thank you.
Thank you, Pat. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Hi, thanks for taking my. You're concerned about some sort of mission accomplished effect with this effort. One of the things here in Logan County and
I'm sorry,
Gary,
we're having a little bit of trouble hearing you. Are you there, Gary?
Can you hear me now? Damn.
So
Try it again, Gary.
here, Gary, we'll come back to you for the next question. Let's go then to Lisa Balick with Coin.
Good morning. Two questions, one for the governor, one for Director Allen. Governor, you want elementary students back in the building, in the classrooms by the end of the month. How likely is it you'll, though, grant school districts like Portland a waiver from that if they can't reach an agreement with their teachers union?
Thanks, Lisa. Look, I am very excited to see the thousands of kids that are headed back to either in-person or hybrid learning over the next few weeks. We have at this point over 170,000 kids back in the classroom. This is really good news because we all know that in-person learning is a much more effective educational strategy. And we also know, frankly, that our kids have been suffering as a result of the pandemic. So not only is it critically important for kids to get back into the classroom for the educational supports that it provides, but also the social, emotional contact with peers. A lot of these kids, it's an opportunity to get 2 square meals a day. And for some kids, unfortunately, the classroom is a really safe place. That's fortunate in the classroom is safe. It's unfortunate that their homes are not. In terms of Portland and other districts, I know that superintendents are working in districts across the state collaboratively and collectively with their educator workforce. I really appreciate everybody coming to the table. I know that a number of the teacher associations signed on to the letter saying, we welcome return to the classroom. And so I'm confident that you will see all of Oregon's districts return in the timeframes I've set out. Obviously, there may be specific districts. I know Beaverton, for example, scheduled for 1 week later than my timeline. They'll be working with the department, and the department will be working with the districts to provide that level of flexibility. But I'm confident we're going to make it happen.
Question for Director Allen, excuse me. Based on the COVID outbreak that we're seeing at Camas High School among high school students, why not allow all teens 16 plus to get that Pfizer vaccine now?
I actually think I might turn that one over to Dr. Seidlinger.
I think, first, those who are 16 and up, they are eligible for vaccine. And if they have underlying conditions or otherwise qualify for a vaccine, we should get it. I don't think that vaccinating a subset of high school students right now will significantly impact spread in schools. What impacts spread in schools is opening schools when rates are lower, as they are in Oregon, and having strong health and safety metrics in place to prevent the spread of COVID-19 in schools. So while this is an unfortunate experience that we're seeing in our neighbors to the north, it is fairly limited to see these kind of outbreaks in schools. We do hope that as we move into the fall, we'll have vaccine available for more adolescents, and that'll be an additional tool we have to lower the risk in schools, as we have here in Oregon, with health and safety guidance in place and school teachers and other educators being vaccinated early so that they can return to school with lower risk and get kids back in front of teachers.
The only thing I would add to that is what I think I understand of the outbreak at Camas is it doesn't appear to have occurred at the school. It appears to have occurred at a social gathering outside of school. And it's yet another reminder that things like going back to school, reopening indoor dining, other kinds of business settings does not mean going back to the way things were before. People need to continue to do all the things we've been doing that has worked so well in terms of wearing masks, avoiding large social gatherings, hand washing. All those things continue to be really important. And I think having a party after school hours in Camas is a great illustration of why that's a problem.
Thanks, Lisa. We'll go back now to Gary Warner with EO Media. Go ahead,
Hi.
Gary.
Yeah, thanks. I got a better microphone now. Always worry about a mission accomplished moment on some of these things that we seem to be so far down the line. Here in Lane County, where I'm at today, we have a new variant that's been discussed. We're also coming up on a week-long spring break for the University of Oregon, in which you're going to see travel back and forth. What sort of steps are you taking to, particularly as we're coming into spring, people are much more active, a lot more people out on the street. You know, are you concerned that that's going to, set the fire back up?
Thanks, Gary. Again, given that we have the new variants on the Oregon landscape, it's even more important that Oregonians continue to comply with safety protocol. We all, I know, are ready to let our guard down. We just can't. We have to continue to wear masks. We have to continue to watch social distancing and obviously continue to wash our hands. And we're encouraging every Oregonian that's eligible, of course, to get vaccinated as well to help reduce transmission. In terms of spring break, I do recall a spring break in 2020 where folks flocked to the beaches and there were parties at our, I won't pick on the University of Oregon, but there were certainly parties on university campuses across the state. We know that these events, when people do not follow the safety protocol, can be super spreader events. We know that these variants are highly transmissible. We need to continue following the safety protocol if we want to see our schools continue to open, if we want to see our bars and restaurants continue to open, if we want to continue to move back to normal life.
Okay, and I've got just one quick follow-up on K through 12 schools. Some schools are saying the social distancing rules are just too tight, and they would like to see a relaxing on that. What are your thoughts on that, and when might they see some action if they specifically requested it of you?
Dr. Seidlinger, do you want to tackle that issue in terms of safety protocol in our elementary and secondary schools?
Thank you, Governor Brown, and thank you, Gary, for that question. I think as part of the governor's directive on Friday, in addition to having more students back in in-person instruction, directed us at the Oregon Health Authority and Oregon Department of Education to review our health and safety protocols, looking at physical distancing, looking at cohort sizes, looking at entry screening, and other public health metrics are certainly on the scale. The CDC right now requires physical distancing for those communities that have higher spread of 100 per 100,000 over the previous 2 weeks or higher. The American Academy of Pediatrics recommends a distance of 6 feet when possible, though several states have moved down to 3 feet, where the AAP and the CDC says is acceptable at lower transmission rates. We'll look at the current research that's out, including a study that came out of Massachusetts that showed equivalency between a 3 foot and 6 foot distance, and see about making changes to the current guidance. But we may phase in these changes over time to lower the risk and ensure that we're bringing students back to school and not seeing spread, so that we can move towards a time when, particularly in the fall, school will look much more like it did in 2019, but we may need to ease into it and add different safety metrics in place to get there.
Thank you very much for your time.
Thank you, Gary. We'll go next to Bradley Parks with OPB. Go ahead, Bradley.
Hi, thanks for the time this morning. I'm curious to know, given the Biden administration's goals for vaccinating people, how much Oregon would need to increase in terms of doses received every week, or how many administered every week, in order to, meet those goals?
Thank you, Bradley, for the question. I just am really proud of the collaborative work that's happening across the state. We've got our local partners, local public health. We've got our hospital and health systems, folks in the metropolitan area, all working hard to make sure that we are expanding capacity and getting as many vaccines into arms as possible. We're frankly running about in the neighborhood of 20 to 25,000 per day vaccinations. We're going to have to substantially increase that capacity, and that, of course, is dependent upon supply. Director Allen, do you want to complete the the counts?
Yeah, thanks, Governor Brown. Thanks for the question. Currently, we're receiving about 126,000 first doses a week. Our current projections and our current schedule are based on that ramping up to 200,000 doses a week, which would get us to the general public by June. So to move that date up by a month would probably require a further doubling of those doses. I offer that just a little hesitatingly without being able to go back and actually do the math, but it would need to be an increase on that kind of an order of magnitude. As I'm sitting and thinking about the math in my head, maybe only 300,000 doses, 400,000 more people over the course of April, basically, to be able to get to move that schedule up.
Thank you, Bradley. We have time for just a few more questions, so we'll go next to Genevieve Riom with K2. Go ahead, Genevieve.
Thank you for taking our questions today. I have two questions and I'll ask them one at a time. The first one is for Governor Brown. Will you be withholding funds from schools who do not comply with the executive order?
Look, my executive order that I signed this morning has the same authority, has the force of law as all the other executive orders I've signed. And the department does have the ability to enforce that order. I am confident that it will be not necessary. I know that our educators, our bus drivers, our lunchroom personnel are as excited to see the kids back in the classroom in communities around the state, as excited as the kids are to be back in the classroom. So I know the department will work with districts that need flexibility regarding the timelines, but I'm confident we're going to get our schools back into in-person instruction very quickly here.
Okay, and my follow-up actually ties into that, but several school districts have told me that they believe they'll be able to keep their current hybrid timeline, even if it doesn't match your deadline. Are you going to be updating the executive order with an exception clause, and if so, when?
I believe the executive order sets forth all of the frameworks, what's permitted and what is not permitted, and both hybrid and in-person instruction are permitted. And then parents have the ability to choose comprehensive distance learning if they feel that that is what is safest for their kids.
Sorry, I think maybe I was confusing with the question, but for the districts whose timelines to return to hybrid learning are not by March 29th or what your deadline was, you mentioned Beaverton School District as an example. Are you going to be providing more exceptions for certain school districts?
Not within the order itself. The department has the ability to work with these school districts to make sure that they are getting their students back into the classroom as safely as possible, as quickly as possible.
Okay, thank you.
Thanks, Genevieve. We have time for just a couple more questions, so we'll go next to Julia Silverman with Portland Monthly. Go ahead, Julia.
Thanks so much for taking my question. I have two and I'll be quick. Number one, I'm wondering if essential workers includes grocery store employees and restaurant servers. And number two, piggyback on the schools question, is the state going to be providing any sort of direction about what kind of instruction is provided? For example, we've heard some school districts say it will be, solely study halls or enrichment as opposed to academics. Thank you so much.
Thanks, Julia. In terms of essential workers, our frontline workers, I want to say thank you. We have folks that have been working in our grocery stores, working in restaurants throughout this entire pandemic. Honestly, frankly, to keep our society going, and I really appreciate both their courage and their sacrifice. We are absolutely committed to including these workers in the frontline worker category. With the accelerated timelines that the Biden administration announced last night, we expect to be able to move those timelines up, but we want to make sure that these critically important workers get their vaccines. And then your second question again, please, Julia.
Yes, thank you. It was about whether you have expectations for the kind of instruction that schools will be providing when buildings reopen. Some districts have indicated that there will be a focus on academic classes, and some are telling us that it will be study halls, for example, or enrichment like, gym or music, also important.
Julia, as you know, this is really up to the local districts, but I am absolutely committed to making sure that our students, regardless of whether they live in a rural community or an urban community, get the educational support, the academic support that they need. It is going to look different in different schools across the state. And we want to make sure that our kids have the educational opportunities they need to move to the next academic level. Comprehensive distance learning has been extremely challenging for a lot of kids, and we know that in-person instruction will provide a better educational format for a lot of our kids. We know that our kids are also struggling with social and emotional behavioral health issues. We know that our schools can provide the supports that a lot of our kids need. And that's why we've been working so hard, frankly, for the last several months to make this happen. I don't know, Dr. Seidlinger, if you want to add anything to that.
Thank you, Governor Brown. I will say, to reiterate what Governor Brown said, several of these decisions are left up to the local decision makers in the local school community based on needs. The Ready School Safe Learners sets up some very strong health and safety metrics and protocols, many required and some recommended. How those get implemented based on the operational capacity, the needs of the school community are left up to the school themselves. They can use block schedules, other tools to try and bring folks back as they move children from comprehensive distance learning for the students and the teachers through hybrid and hopefully to full in-person instruction as rates go down and their operations allow it. So, schools are making those decisions and having those conversations and doing so with a strong health and safety framework in place.
Thank you, Julia.
Charles, Charles, I know we've had a request to hear from Dr. Messer. If he could take a moment and just briefly share with Oregonians the work they have been doing at Oregon Health Sciences University, and there may be a question.
Yeah, thanks for that. So ever since the pandemic really started, as everyone has pointed out previously, about a year ago, we felt that it's really important to understand the genetic changes in the virus that we know are inevitable as the virus is transmitted through populations. And that is ultimately what led to the detection of the variants that Drs. Seidlinger and Dr. Edwards referred to earlier in the conversation. It's part and parcel to how we begin to understand the landscape that we're dealing with. It's like walking into any new environment. The first time you walk into the woods, you don't know what represents a danger sign. You don't know what represents something friendly. And until you spend time in that environment, you really don't know how to interpret all of the signals you get. We've now started to get a sense of what the landscape looks like, what the environment looks like, what noises might be dangerous, what we think we can set aside. And this is going to be an ongoing process, but it's a critical process to learning how to navigate any environment safely. We're talking here about navigating, a virus transmission environment, but in many ways, it's no different from any other new environment that you enter. You have to study it and learn about it and learn what constitutes a risk and what doesn't. And that's what we're really striving to do with our sequencing enterprise at OHSU.
Thank you. Charles, do we have any further questions in particular for Dr. Messer?
Yes, we had one question that came in writing, Governor, from K2. It asks, Dr. Messer, can you speak for a moment just about the variant activity that we're seeing in the States, and what concerns do you have about the mutations you've seen so far?
Well, to echo what I just talked about a second ago, and what Dr. Edwards mentioned earlier, the concerns are some of the similarities between the new variant that we saw emerge in the UK background spontaneously here in Oregon and some of the other variants that have been associated with higher transmission risks in South Africa and Brazil. We don't really understand exactly what the implications are for this variant because it hasn't been well described anywhere in the world yet. But because it shares a marker, we think it's something that we need to keep an eye on. overwhelmingly, the same precautions that we've used to control every other variant that's moved through the state will still work for this variant: mask wearing, physical distancing, the things that people have mentioned elsewhere in this broadcast. And I would say that until we really know what these variants mean, whether or not they become present, or whether we succeed in stamping them out by implementing measures and contact tracing and controlling outbreaks, maybe we'll never actually find out because that's happened. But even so, continuing to look for and uncover as quickly as we can the emergence of these new variants allows us to better understand the transmission landscape and the risks that are posed in the landscape that we're looking at.
Thank you, Dr. Messer. We really appreciate your critical work at OHSU. Thank you, Dr. Renee Edwards, as well, for joining us today. Thanks to Dr. Seidlinger and Director Allen for your hard work. And with that, just want to encourage everyone to continue to follow your safety protocol. Wash your hands, watch your physical distance, wear your mask, get a vaccine if you're eligible for one. And please stay safe out there. I know that together we can crush COVID.